Dear learners, location is expressed as latitude, longitude and altitude. Geographers firmly believe that location matters, and this module will help you understand the importance of location. Welcome to the Swayambhu course on Geography of Health and Well-being. Today's module will focus on housing and its impact on human health. We will learn about the importance of location, where we spend at least 8 hours every day, that is 56 hours a week or 1680 hours per month or over 20,000 hours an year or 2,41,920 hours if our life expectancy is 65 years. Now that is something significant. The module aims to discuss the role of residential environment in the etiology of illness. The topic of adequate housing for the maintaining of health and well-being has been recognized, but the links remain elusive and vague. Housing conditions affect health at individual level but are shaped by societal and economic forces. Housing actually translates into social adversities, into individual illness and population health disparities. Housing can have a mediating role in determining health outcomes. These outcomes can exist at multiple levels and can be socially structured, neighborhood or individual family. Housing is a basic human right. It does not mean that having a shelter, but needs to be adequate housing in terms of legal security of tenure, availability of services, materials, facilities and infrastructure, affordability, habitability, accessibility, location and cultural adequacy. In that sense, housing as home is not a physical shelter but also a foundation for social, psychological and cultural well-being. In 1971 census, house was defined as a building or part of building having a separate main entrance from the road or common courtyard or staircase etc., used or recognized as a separate unit. It may be inhabited or vacant, it may be used for residential or non-residential purpose or both. The census differentiates between individual houses and flats. An independent house is one which has separate structure and entrance with self-contained arrangements, while a flat is a part of a building and has one or more rooms with self-contained arrangement and normal housing facilities. A house is further classified as Pakka house or Kacha house. Pakka house is one where the wall material may be burnt bricks, stones packed with lime or cement, concrete, timber, ecra, etc. and roof material may be tiles, GCI sheets, asbestos, cement sheets, RBC that is reinforced brick concrete, RCC reinforced cement concrete and timber etc. In a Kacha house, the walls and or of roof are made of materials other than those mentioned above, such as unburnt bricks, bamboo, mud, grass, reeds, thatch or loosely packed stones etc. There is another category, that is a semi-Pakka house, which has fixed walls made of Pakka material, but roof is made of material other than those used for Pakka house. Other than the formal housing, Informal housing such as slums may exist in various countries. The differences in formal and informal housing to some extent are reflected in the material used for construction, quality of construction and durability, which is what reflected in occasional surveys carried out by National Sample Survey Organization in India. The slum areas are defined by Census of India. These broadly constitute of all specified areas in a town or city notified as slum by state or local government and union territory administration under any act including Slum Act. All areas recognized as slum by state or local government and union territory administration, housing and slum boards, which may have been formally notified as slum under any act, and a compact area of at least 300 population or about 60 to 70 households of poorly built congested tenements in unhygienic environment, usually with inadequate infrastructure and lacking in proper sanitary and drinking water facilities. In developed countries, a house is a composite of land and built space with the use of appropriate materials, technology and well developed land with clear tiles. Apart from the material and quality of construction, the amenities and infrastructure including water supply, toilet, electricity, sanitation, ventilation, number of rooms in proportion to number of members, etc. are added significant elements of housing. We are convinced that health is not a factor of only biological factor or environmental factors. Rather, health is socially determined. The role of social determinant is significant. These social determinants can operate at various levels from individual to structural. The rainbow model of Dahlgren and Whitehead is most widely used model of its kind worldwide. The model visually represents how various layers of factors influence an individual's health using a rainbow-like diagram to illustrate these influences. The model maps the relationship between individual, environment and health. This was developed in 1991. We can see the different layers of rainbow model. These are individual lifestyle factors placed at the center of the model. This layer includes personal behavior and lifestyle choices such as diet, physical activity, smoking and alcohol consumption. These factors directly affect the health and are influenced by personal knowledge, attitudes and skills. The next layer is social and community networks. It surrounds the individual layer and includes social and community interactions such as family, friends and social support systems. These relationships can have significant impact on health by providing emotional support, practical assistance and influencing behavior. The third layer is living and working conditions. This layer includes factors related to environment in which people live and work. It encompasses housing, workplace conditions, education, healthcare services, access to food and water, and leisure activities. The last and the outermost layer is general socio-economic, cultural, environmental conditions that includes factors such as economic policies, cultural norms, societal values, environmental conditions and public policies. These overarching influences shape the conditions in which people live and work, thereby affecting the health of population. In contrast to more medicalized model which start with specific causes of a disease, The Rainbow model focuses on determinants of health. It places the individual at the center, with various layers influencing the health surrounding them. Housing is identified as a key determinant of health here. It is an upstream determinant, meaning improvement in housing has the potential to reduce health inequalities. Living environment directly and indirectly affects health in several ways and represents one of the key social factors. Due to complexity and wideness of its components, multidisciplinary approach is used to assess the relationship. All the housing and neighborhood related conditions can be classified under three broad categories. Area characteristics, which includes physical, social and economic environment in and around the house. Physical environment embodies elements including location, density, building height, sanitation, air and water pollution. It may also be access to green spaces, pedestrian walkways, reduced or increased exposure to chemicals, etc. Social environment may be community sports, low crime rate and social cohesion, while economic environment may include quality schools, healthcare facilities, employment opportunities, markets, etc. The internal housing conditions refer to physical state and quality of dwelling itself, including factors such as structural integrity, the strength of the building, sanitation, heating, cooling, ventilation, and presence of hazards. Housing tenure. This refers to the legal term under which a person lives in a house, such as ownership. Is it owned house or rented house or social or public housing? Each of these factors affect health and well-being. For instance, deprived areas may experience high crime and violence, making it stressful and dangerous places to live. Access to amenities may be worse than in affluent areas. There may be lesser opportunities available, and internal housing condition may not be conducive, and healthy, cold and damp conditions, poor amenities may lead to disease, illness and accidents. Lack of smoke alarms, fire sprinklers, emergency exits can make them more prone to disasters. Burden of debt or loan may increase stress, anxiety and worry. Recently, Taylor, based on new evidence, modified and integrated these categories and called them pathways. Here are the factors linked to housing and neighborhood conditions that influence health. These can be grouped into 4 categories. First, considers the house impacts of not having a stable home, that is residential instability. Second, the financial burden resulting from high cost housing, that is affordability. Third, the health impact of conditions inside the home, that is housing safety and quality. And lastly, health impacts of neighborhoods, including both environmental and social characteristics of where people live, that is neighborhood. The figure given below shows the factors connecting housing and health. The arrow thickness indicates the level of evidence of health impact. Stability and internal housing conditions are regarded as most important pathways. Stability is an outcome of permanent settlement at one place for generations. Housing instability is a result of migration that may be voluntary, forced or displacement. People migrate due to poverty, discrimination, disasters and political instability. This causes residential instability. Housing stability is often measured by indices of mobility, the number of times an individual or family has moved or the length of time in the present dwelling. The percentage of individuals or families in communities who have lived in the present dwelling for a specified period of time, and pattern of in and out migration in the larger region as a result of immigration policies. Stability also relates to the strength of the house with respect to building material of walls and roofs, so that it can protect the people from disasters and accidents. Internal housing conditions are related to infrastructure in the house, indoor pollution, thermal discomfort, pests, ventilation, etc. If the house is rented, the problem may be aggravated, as neither the landlord would like to take the responsibility nor the tenant can afford maintaining the house. Outdated infrastructure, damp walls, old carpet, poor sunlight and ventilation induces several effects, from airway to musculus membrane irritation to irreversibly damaging the brain and nervous system of children, but also several chronic diseases and cancer. Residential crowding has been linked with both physical illness, that is, for example, infectious diseases, and psychological distress. The next important pathway in area characteristics is that the neighborhood. Imagine a neighborhood without parks, gardens, safe spaces to walk or cycle, without markets, grocery stores. Additionally, the cultural and social environment that is discriminatory and toxic. It is impossible to manifest good health in such conditions. This factor also tries to understand how society distributes resources amongst its members and consequently on health opportunities of population. Finally, the fourth pathway is affordability, meaning the cost of the house and to afford decent living. It is a fact that cost of living changes with the area in which the house is located. For instance, cost of living is higher for someone living in New Friends Colony or the one who is living in Sainik Farm or in Nepsarai or slums of Delhi. Living in an unaffordable housing is related to poor self-rated health, hypertension, arthritis and mental health issues. Low income families with difficulty in paying the rent are likely to have usual source of medical care and are more likely to postpone their needed treatment. Now let us come to housing and health. Housing is a mediator between environmental exposure and health. Notable physical environmental toxicants and home allergens are particulate matter, polycyclic aromatic hydrocarbons, diesel exhaust particles, nitrogen oxide, allergens, mold and lead. In developing countries such as India, fuel wood is the major cause of indoor air pollution. Exposure to indoor air pollution may be responsible for nearly 2 million excess deaths in developing countries and for some 4% of the total global burden of diseases. Holdren and Smith describe that income and fuel wood use is directly proportional to each other. Households at lower level of income and development tend to be at the bottom of energy ladder, using fuel that is cheap or locally available but not very efficient or clean. However, according to WHO, over 3 billion people worldwide are at these lower rungs depending on biomass, fuels, crop waste, dung, wood, leaves, etc. and coal to meet their energy needs. The effect of this indoor air pollution is not uniform for all members of the household. It is generally the woman who cooks and the children whom they supervise are most prone to respiratory illness. There is emerging evidence that indoor air pollution increases the risk of child and adult health problems, including acute lower respiratory infections, COPD, low birth weight, perinatal mortality, asthma, tuberculosis, cancer, cataracts, blindness, and cardiovascular diseases. It is responsible for 2.7% of DALI worldwide and 3.7% of high mortality in developing countries. Yadav et al. Analyzed the temporal variation in the prevalence of infectious diseases and their relationship with changing household environment in urban India using data from last 3 rounds of NSSO on morbidity and healthcare. They found sharp rise of airborne diseases followed by vector-borne diseases, namely malaria, dengue, chikungunya, lymphatic filariasis, Japanese encephalitis and Kala-Azar in urban India during the last 2 decades. Urban areas have growing trend of infectious diseases due to increased pressure on basic infrastructure. Although there have been a number of policies by Government of India, housing and health remain critical with large population without adequate housing, homelessness, poor housing quality and mismatch in demand and supply of housing, infrastructure and amenities. Look at the image and try to uncover the drivers of ill health due to housing in a slum, people sleeping on streets or in rehabilitation centers, people living in disaster prone areas, housing near landfill sites. Now have a look at these images where all the wires are properly labeled and emergency exit plan is available. Or this one where safety instructions are clearly mentioned. You can easily compare the living conditions at these locations and comprehend the kinds of health risks. The common health conditions associated with poor housing are respiratory infections such as common cold, tuberculosis, influenza, diphtheria, bronchitis, measles and whooping cough, skin infections like scabies, ringworm, impetigo, leprosy, rodent associated diseases such as plague and rat bite fever, arthropods like houseflies, mosquitoes and fleas and bugs that spread diseases, communicable diseases, falls, burns, poisoning, foreign item ingestion, smoke inhalation, drowning, cuts and collision with objects and structural collapse that crushes and fractures bones, all are examples of house injuries. Substandard housing may adversely affect mental health. Excessive indoor temperature has been linked with irritability and social intolerance. The Ministry of Housing and Urban Affairs was set up in 1952 and since then there have been a number of programs and policies to improve housing in India. Some of the recent ones are Jawaharlal Nehru National Urban Renewal Mission, National Urban Housing and Habitat Policy, Pradhan Mantri Gramin Awas Yojana, Rajiv Awas Yojana, Pradhan Mantri Awas Yojana, Draft National Urban Rental Housing Policy, Smart Cities Mission and Affordable Rental Housing Complexes that was launched in 2021 for urban migrants. Now let me share a very interesting case study with you to discuss the importance of location that I myself conducted. Kranti Nagar slum is situated on the periphery of the largest slum of Asia, Dharavi. Is located along the banks of Mithi River in Mumbai. In 2005, there were massive floods owing to heavy rainfall and overflow of Mithi River. The people living closest to the river were affected the most, with their belongings washed away, houses broken, illness, injury and communicable diseases. The MMRDA, that is Mumbai Metropolitan Regional Development Authority, faced huge criticism and eventually devised a plan to relocate the people living closest to the river to relocated or rehabilitated colonies so that they are not exposed to losses from annual floods. The plan was successfully implemented and people were shifted to LIG flats that were built in 8-floor buildings at 4 relocation sites. Here they had to pay some 250 rupees as annual maintenance cost, and Pakka houses were given to them with a bond that they cannot resell or rent it. This plan aimed at providing safe housing in a congested city like Mumbai, saving thousands of people from ill effects of a disaster. But people left the relocation colonies and came back to the slum, leaving the buildings vacant. This is highly surprising and astonishing. When asked the reason for the same, 3 reasons could be identified. One was related to cost. Most people answered that they have to pay extra cost to travel to place of work, school or hospital. Additionally, they have to pay maintenance cost. Second is a social reason, that flats were randomly allocated, ignoring the social ties that existed in the slums. So, your neighbor is not a neighbor in the flats, okay? They believe that they can face and overcome the consequences of floods, but not the loss of finances and social network. And thirdly, and very importantly, these LIG flats had the same wall between kitchen and toilet, which people could not accept. This proves that house is not only a physical structure, but has social and cultural meaning attached to it. So sometimes plans on paper are wonderful, but in reality they fail miserably because human behavior, perception and reaction cannot be predicted. With this, we come to an end of this module. Here is a list of key references. Wish you good health and well-being. Thank you.